Oh, hi, good people. Today, let's look at stages of labor. We mainly focus on the presence of bloody show, water breaking, and we also check the contractions. And for we to say that labor has started, the contraction has always to increase in frequency, duration, and how regular. And all this also has to go with cervical changes, where we are looking at effacement and dilatation. So the main key thing that we do at this point, you need just to do the regular monitoring for you to have better outcome. Now for stage one, it's divided into three phases with the latent, the active, and the transitional phase. The main goal of stage one is complete dilatation and effacement. Now for the latent phase is always the longest phase, and here we're just looking at dilatation from 0 to 3 centimeters with effacement of up to 30%. So the contractions, they're always lasting for 30 seconds, 5 to 30 minutes apart, then they might be irregular. So don't forget that. For active phase, we mainly talk of the contractions from 4 to 7 centimeters, effacement of 30 to 80%. And at this point, our contractions start to be regular, lasting for at least 1 minute, 5 to 3 to 5 centimeters apart. Then for the transitional phase, uh, our contractions will now start to be stronger, lasting at least 60 to 90 centimeters, 60 to 90 seconds, then 30 to 2 minutes apart. Then for the dilatation, it's from 8 to 10 centimeters. So we need to encourage the mother, do not push until the mother becomes 10 centimeters because we are risking most things. So once the cervix reaches 10 centimeters, the delivery of the baby, that's another stage, that's stage two. Then we just need to assist the mother in positioning, the better positioning. Then we can do episiotomy if it's indicated. We don't do in every case. So once the baby is out, the next thing is always delivery of the placenta. At this point now we are at stage three. So we also supposed to do the Apgar score. We are scoring the child. Then we encourage skin to skin. Then we can look for signs of placental separation, that is lengthening of the umbilical cord, and also the sudden gush of blood. But I'm told that this is scraped off from the current guideline. You can go and check it out. So once the placenta is now delivered, we can now do the assessment of the placenta, where we are checking if the placenta has two umbilical arteries and one umbilical vein. And also we can look at the lobes. Are we having any missing lobes? So after that, we now go to stage four, which is now once the placenta is out, up to 2 hours after delivery. What do? We mainly monitor maternal vital signs because we are checking for if there is any other blood loss. So we concentrate on the pulse and the blood pressure. We are trying to rule out, is the patient hypovolemic? Are we having preeclampsia at this point? Then apart from the vital signs, we need also to look at the Lochia. So for the first 1 hour, we assess every 15 minutes. Then we also look at the fundus. Is the fundus well contracted? Did we do the massaging? Did we give the medication, that is now the oxytocins and others, or even carbetocin, depending with the type of drug that you are having? So we also need to always monitor the urine output. We're encouraging the mother to always void because a full bladder can also affect on how the fundus contracts. Then we need also to encourage the aspect of family bonding, where we encourage the mother to start breastfeeding and also to maintain skin to skin contact with the born child. Then if there's any laceration, we need to do assessment, and other things will always follow. That's a brief overview of stages of labor.